What we saw in the first 6 months of the year, driven by the DOGE effort, was a complete cutoff, sudden, no plan, but kind of a fight between DOGE and USAID that ended with everybody at USAID getting fired. And so that was tragic. Then there was a restoration. Secretary Rubio, came in and said, no, we need to bring some of this back. And so the trend line as the year's gone on is to get some restoration. As we speak today, it's not clear whether we'll end up with a 10% cut, which we could handle and drive new efficiency and innovation and be okay, or a 40% cut. But I'm hopeful that the President and the Congress will take that in the right direction, and I'm certainly spending a lot of my time making the case that the U.S. can afford to continue to be generous, and our values haven't changed. Recently, there was one good sign, which was when it came time for the Global Fund pledging, the U.S. came through with a $4.5 billion pledge. The U.S. has always been significantly the most generous there, and that was they came in with 100% of what we asked for. So I think we'll get clarity in the next few months. And, I think, sadly, the fact that we have more children dying, I think, is a wake-up call for some of the people in the administration that we need a pretty full restoration.
Do you believe that that line that for the first time in 25 years we will see more child deaths around the world has a straight line to the cuts in funding by the U.S. this year?
The U.S. is not the only government that made cuts, and so it's not solely them. But because their cuts were made in such a sudden and unpredictable way, with medicine stuck in warehouses and thrown out, contraception thrown out, people fired overnight, it was particularly damaging the way it was done. And now they're going out and trying to remedy some of that. They're doing these, what they call global compacts. But absolutely, many people don't know the miracle of the last 25 years that we cut the deaths in half. And if you know that took place, that was directly because, WHO was funded, Gavi was funded, Global Fund was funded to do the incredible work that they do. And so when you take the money away, it's clear what's going to happen.
You say many didn't know, and you're absolutely right. I wonder whether that includes the US president. I just wonder if you can share the spirit, if not the content, of your discussions with Donald Trump about these cuts and the importance of saving lives and maintaining US leadership. Just briefly.
Well, there's many metrics you can have. If you look at overall aid, Europe has been very generous. Now the Middle East, particularly UAE, is very generous. Within Europe, Norway and Sweden have been real standouts at over 1% of GDP. The U.S., in absolute, is the biggest aid giver, and particularly in global health. The share of the aid budget that the U.S. spends that's global health related is very high, almost 50%. And that really goes back to President Bush at the turn of the century, created new programs, particularly the HIV program, PEPFAR. He committed to fund a third of Global Fund. He created President Malaria Initiative. That was our one big step up in generosity that on a per size of the economy basis didn't get us to European levels, but it got us closer to that level. And, so now, now we have an opportunity because we have new tools and innovation. The impact per dollar that we can have will increase. And so if we can just get aid, to go flat, then the innovation piece, particularly accelerated by great AI work, will allow us to get back on track. And so, we're in a period where we have to raise the visibility, tell people about the possibility. The message everyone's hearing tonight, we hope you'll spread it far and wide. And we're going to be a lot more creative. As we're talking to religious leaders, they want to help us carry this message. As we talk to people who work in medicine, They care about lives everywhere. They want to help us carry this message. So we have to renew our outreach because this is such a strong moral cause.
And the current president of the United States gets that.
He has said that he wants to go to heaven, and that if he's responsible for lots of children's deaths, that maybe that's not going to go the way he wants it to go. He is someone who's been willing to meet with me and talk about these things, and that makes me hopeful that we'll get most of the money back. And I know, the Congress will have a role in this, and they've always been very, very supportive.
Yeah. Thank you. Reem, progress is hard won in conflict and instability, of course, where so much of the work, of course, is needed and is done. While the world waits for to see whether a Gaza ceasefire holds and whether we can ensure the tangible steps to ease the massive humanitarian crisis there, I know how much work you have done over the last couple of years, Reem, on trying to ensure that we can address that crisis there. It has been phenomenal. There are consistent warnings now, of course, about the scale of another crisis, that being Sudan. The UAE has renewed its calls for an immediate ceasefire there. What more are you doing to pressure the groups the UAE has influence over to stop the fighting and enable the humanitarian relief?
Becky, leadership is very important. And the US leadership on this file has been critical because the crisis in Sudan didn't just begin. The crisis in Sudan was underway even as Gaza was underway, even as Ukraine was underway. The fact that President Trump had put forward a plan through the Quad, which includes the Kingdom of Saudi Arabia, the United Arab Emirates, the United States, and Egypt, to really address three main things. In essence, an immediate ceasefire so that we could have humanitarian aid go in unfettered, unhindered throughout the entire country and where it's necessary. The fact that we have to have a civilian government because none of the military generals are able or equipped to actually represent the people of Sudan. And most importantly, the immediacy of ensuring that this happens to allow for aid to go in immediately, as this was already announced a couple of weeks ago, and yet it hasn't been able to happen. We saw that there were convoys that were attacked and also bombings in civilian infrastructure that only brings in more misery to a very difficult situation. We have been consistent throughout and are really relying on US leadership to be able to take this one home all the way through. I just want to also add, today the UN Global Appeal was announced. That was $23 billion in 2026 to save a little over 87 million lives. The UAE is going to be committed to that. But beyond that, again, a call to action. There are ways in which we can deliver and we can succeed if we just hold on long enough and believe long enough in coalescing around those that are very focused and singular-minded in the impact that is possible.
To both of you, what do you say to critics who might say that the focus, for example, on polio eradication and much-needed global philanthropy is rendered moot if we don't take more concrete steps to end conflict and instability like that which we see in Sudan?
I think we have to activate all fronts. We can't wait for a conflict to be addressed at its root cause by not engaging on the humanitarian or on the development or on the political lens. Obviously, if you fix the root cause, you don't have any issue at all. But what happens when the root cause isn't fixed? We have to get more comfortable doing multiple things at the same time.
The political actors can bring about these ceasefires, and actors like Gates Foundation, where we're a health expert, then once they get things stabilized, us and our partners can come in and, make sure the vaccination rates go back up. We had polio in Gaza. They were able to go in and do vaccination campaign And we got rid of it there. Hopefully the health infrastructure gets rebuilt, the humanitarian aid gets in, but all of those 4.8 million deaths need to be a priority for the world because it's a richer world. It doesn't cost a lot. We're asking basically for 1% of the budget of rich countries. For the U.S., that would be a huge increase. We're well below that. And so every cause of childhood death, including violence, I'd say we can afford to make progress on.